name is William Waters, and today I will be talking to you about viral meningitis, a disease of the spine and brain. Viral meningitis is a disease that infects the meninges, which is a lining of the brain and the spine. It's caused most by enteroviruses, which are spread most commonly through fecal contamination and through respiratory secretions such as saliva, mucus, and things from the nose and mouth. Interesting fact about viral meningitis is that between 25,000 and 50,000 people visit the hospital every year for viral meningitis. It's caused by many different things. It's caused by mumps, influenza, arboviruses, which are things such as mosquitoes and other insects in the same family, herpes, HIV, measles, and lymphocytic choriomeningitis virus, and that is a disease that's spread through rodents, such as mice and rats. There are 5 different types of meningitis. Bacterial meningitis, which is caused by bacteria. Non-infectious meningitis, which is spread from person to person. Viral meningitis, which is which I've already told you the cause of. Fungal meningitis, which gets to your system through the nose or mouth. And parasitic meningitis, that is caused by a parasite. The symptoms that most people experience are nausea, vomiting, photophobia, which is skin sensitivity to light, and constant confusion or an altered mental status. Those symptoms are what happen to everybody, but these are symptoms that specify to different age groups. Infant symptoms are fever, irritability, lack of appetite, and they are hard to awaken. And adults who have the disease have symptoms such as high fever, severe headaches, stiff neck, photophobia. They're hard to awaken. They have nausea and poor appetite. Here's some of the history of viral meningitis. Viral meningitis was first described to the public in 1768 by Robert White, who was from Berg. In 1805, the first meningitis outbreak was in Geneva, Massachusetts. In 1840, the first outbreak of meningitis in Africa. That was the first time that it happened in Africa. And the places that it affected the most were Nigeria and Ghana. In 1887, that was the first time that bacteria was discovered to be linked as a cause to meningitis, and that was discovered by Anton Weisselbaum. And in 1944, penicillin was discovered to be effective in curing meningitis or preventing it. And this was discovered by George Joachim, and he discovered this by trying to cure it using serum therapy as well. It's transmitted through 3 main ways: fecal contamination, respiratory secretions. Those two are caused most by enteroviruses, and contact with an infected person or things that an infected person have had lots of contact with. There are different risk factors that affect how likely you are to get the disease. The first one is that it affects children the most, mainly children under the age of 5. Those are the people who are most vulnerable to the disease. Who are also more vulnerable if you have a weakened immune system, or if you come into regular contact with infected people or someone who has the disease. Treatment for the vaccine. Treatment for the disease. There are vaccines for the specific diseases that cause viral meningitis, such as measles, mumps, herpes, and influenza. but there are no antibiotics to cure the disease because since it's viral, antibiotics have no use in it. But people who have the disease generally recover in 7 to 10 days naturally. Prevention. There are different ways that you are able to prevent viral meningitis. The first one is to wash your hands. Second is to disinfect frequently touched surfaces. Third is avoid sharing with infected people. 4 is to get regular vaccinations. 5 is avoid mosquito and insect bites. And 6 is to do regular rodent control. My experiment was on it's called serum procalcitonin in viral and bacterial meningitis. It was based on to see what can distinguish between viral and bacterial meningitis the best out of these different methods. Clinical criteria: gram staining, bacterial antigen testing of CSF levels. CSF levels include protein levels, white blood cell count, leukocyte count, and these are the different ways that people have used it in the past, but none of these have guaranteed 100% efficiency. Bacterial meningitis, it generally lasts 2 days before it shows the effects of the disease, and viral it lasts 3 to 8. And procalcitonin shows an increase in the bacterial infection level, and so it is used to differentiate between the two diseases. And procalcitonin doesn't increase at all when it's in viral meningitis, and so it's easier to tell between the two. The objective in the disease was to see what serum procalcitonin's role was in bacterial and viral meningitis and differentiating between the two. In this experiment, there were 40 children who aged from 4 months to 12 years old. It lasted from July 2007 to December of 2007. 20 of the children had viral meningitis and 20 of the children had bacterial meningitis. You could tell if the disease was bacterial if the results of bacteria and gram staining were positive, or if there was positive bacterial culture. And you could tell if viral meningitis was there if there was positive viral culture or negative bacterial culture. Blood serum samples were taken from healthy people and the 46 children and were cross-investigated. And the samples were centrifuged at 2,000 rotation for 15 minutes, and they were stored at negative 80 degrees Celsius until they were used for analysis. Here on table, these are the results of the experiment. At table 1, it shows there were for bacterial meningitis, there were 10 males and 10 females. The ages and months were 60.6 plus or minus 25. The people who had the fever, that was all 20 of them. Nausea or vomiting there were 12 of them. People who had headaches had 9. Convulsions had 9, parotitis had none, and meningeal irritation signs had 5 as well. Here on table 2, here were the laboratory findings of all of the groups. CSF leukocyte count, that's one of the methods that they used previously to determine if it was viral or bacterial. You can tell that this 940 plus or minus 256 people, and viral had 170 plus or minus 125. And here are the different leukocyte counts. That's 0.75 plus or minus 30. This 0.17 plus or minus 0.12. And here are the different ones for milligrams and milliliters. Table 3 shows the serum procalcitonin level and the white blood count in all of the groups. Procalcitonin had 26.8 plus or minus 12. CRP had 24.4 plus 12.1. And white blood count in millimeters had 18.4 plus or minus 9.1. And here's a p-value for each of the 3 separate methods. And in the last graph for the results, It shows sensitivity, specificity, if it's positive, and negative predictive values of the admission PCT. The sensitivity for PCT is 100. For 10, it is 88. 90 for CRP, and 76 for CRP to 20 milligrams. In conclusion, for the experiment, it was determined by the researchers that CRP-CT was better than CRP and leukocyte count at distinguishing between viral and bacterial meningitis, and it was more effective in determining how effective bacterial meningitis treatment was in patients. In conclusion, viral meningitis is a disease that affects the meninges, which covers the brain and spine, and the different symptoms of it are nausea, vomiting, photophobia, and lack of appetite. And it mainly affects children under the age of 5. Thank you.
Alright, if you have any questions or willing to raise your hand, we'll call on.
I would have asked the second thing about words, one of the words, it was like cross of the I didn't know what the definitions for words were.
Oh, procalcitonin. That is actually, it's a polypeptide that is found in C-reactive proteins in the DNA.
I had a question. Do you know when exactly, like, what year range or, yeah, do you know when exactly around, what time was the disease published?
When did the experiment take place?
When what?
When did the experiment take place?
No, like the disease period, like.
It was discovered?
Yeah, discovered.
Oh, it was discovered in, Jordan.
How long was the incubation period for viral meningitis?
72 hours.
Do you know who takes the credit for discovering? I don't know if you're saying.
Yes, it was Anton Van Seppel.
Oh, when was the very first case? Where was it? The
Where
very
was it?
first case of this, where was it?
Edinburgh.
Where is that?
It is in Europe. Yeah, I have.
I'm not sure if you said this or not, but what are convulsions?
You're that?
What are convulsions?
What are convulsions? What's a convulsion?
Oh, a convulsion. That is, it's a spastic movement of the body. Mine.
Can people die from disease or have any other disease?
Viral meningitis generally isn't fatal, but if you have one of the risk factors that I mentioned earlier, like being under the age of 5, being a child, or having a weakened immune system, and you don't get treatment for it, yes, you can.
Where is this disease most common?
I am not sure. That is a great question, and I'll have to get back to you after I research something. Chris.
You get viral meningitis
Excuse me?
Did you get viral meningitis from the other meningitis disease?
No, you cannot. You don't have. But she,
How do you get this disease from rats? Mice or rats?
rats are, they generally they can get bitten, or they get infected by the parasites who have the disease, and then they spread to.
Sorry. How does that happen?
Like, Noah says that they are infected by arboviruses from mosquitoes. Well, if the rodents get bitten or attacked by the mosquitoes, they can get the disease from them, and then they can transfer that to humans.
So, I'm not understanding.
I think her question is how the rats transmit it to the human.
Oh, they bite. By biting.
Okay.
Alright, Jasmine.